Hi everybody, it's Win Brown with April Fool's Day, no fooling. Update for Heywood Healthcare. It's Friday, kind of a cold, yucky day, but tomorrow looks very good. It's late Friday afternoon and I am at Holy Cross to pick up my youngest so we can go celebrate birthdays with her sister as well down in Connecticut. So hopefully we're gonna have a nice day down there as we celebrate their birthdays. My girls were born on the same day, 3 years apart. So gonna have some fun doing that. There is a slide, as usual, embedded with our testing and what we're seeing for incidents in the community. We have 5 inpatients who have COVID, 3 only with active COVID, but 5 that are considered COVID positive, originally down to 3. So you can take a look at that. We also celebrated National Doctors Day on the 30th and delivered chocolates from Priscilla's to all our physicians across our service area. So appreciate Priscilla's helping us celebrate. And also congratulations to Gail Cadlick, who leads our library and our CME program, and our continuing medical education program was just given a 4-year accreditation, which is fantastic. Now to some information just that everybody needs to pay attention to regarding our construction. And this really has to do with our power plant work. On the 9th of April, coming up in just 8 days, we're going to have a power shutdown to the facility to accommodate our energy project and to make sure we have everything we need for our new surgical pavilion that's coming up. So we're going to run emergency power for a period of time as National Grid installs 3 new utility poles to reroute our power to our campus. So just to let you know that, keep an eye out for some extra information on that. And also for our community health initiatives, we do a number of programs, one of which is our youth behavioral health program that Maureen Donovan runs for us, and she's has a brand new newsletter out, and so there's an attachment for that for you to take a look and see all the great work that she and her team are doing, and how we're leaders actually in the Commonwealth when it comes to telebehavioral health. There's also, we are recruiting people who are just graduating with their RN. There's a link here. Please share it with people who are finishing up their RN degree and the great things that they can do at Heywood Healthcare as a member of our team, and how we will support them with tuition assistance and other things. Also, cardiac stress testing. You're no longer required in advance to have a stress test, but you still need to schedule that stress test if you had tested positive 2 or 3 weeks post being positive for COVID. So that's a change. And then stepping out for service, Caroline Wazinski, social worker and GPU, we recognized her for representing our care values, always fun. And then we did selfies for the Heywood shuttle, which I've ridden this week, which actually is a blast. Get to see people you don't normally see and touch base, and it's really quick and easy, so I encourage you to do it. So people who send in their selfies, and they're embedded here, are Angela Fleming, Kim Fuller, Sharon Bono, my assistant, Cassie Tessier, and Val Kelly. So take a look at that. Heywood swag gift winners, see Ann Brewer to select an item. Jesus Cortez, Jane Katow, Teresa Thompson, Miranda Walton, and Amanda Hansen. So fun stuff, trying to keep it light as we work our way through into spring and do the shuttle. So just some updates. The shuttle doesn't run on a schedule. Just everybody know that it continues to circulate earlier in the day, and at shift change there's 2 of them running, and then one runs continuously. I had to catch one mid-afternoon, and it was there within 4 or 5 minutes. It was easy. And remember the main parking lot, which we call the North Lot. Hold on, I got a kid at my door. Just a second, let me finish. The regular north lot that we call the Ringe lot is really for 2nd and 3rd shift, so we can accommodate them. So please make sure you use the Mount Wachusett, or you park on the 2 streets or our other lots on our campus. So just make sure and read about that. We will tow you. So if you decide that you're going to get creative and park on lawns and make other parking spaces that create issues of safety and other, you'll be ticketed, and it's a 3-strike you're out policy. And so we have to be serious about this and make sure we do it well. So please park appropriately. Please plan your time appropriately. And just to the Favor building atrium entrance, which is where the big glass will be unlocked starting at 6:30 a.m. to 5 p.m. for people who are parking across the street and want to come in that side entrance who are staff. And also, if you're parking for medical use on our campus, please know that you can either check in when you come in and let the screeners know, or if you happen to get a ticket because you were at parking where you shouldn't have parked, you can take a picture of it, send it to Neil Desai, or inter-office it with a note, so that we can just make sure that we don't ding you if you were here for personal reasons. But you don't need to contact employee health for that. And then also everybody needs to give their license plate in to their supervisor by the 4th. And then boosters, if you haven't got your booster, you need to get that done, because in about a week we will be sending letters to people who didn't get their booster telling them that they voluntarily resigned. So we don't want that to happen. So make sure you talk amongst yourself and get that done. And there's a bunch of save the dates that are included as well. So thank you very much for everything you do. Thanks for everybody for riding the shuttle this week and changing your parking style and place and being flexible, and actually a lot of great comments. People actually are enjoying meeting up with other people as well. So as we continue our journey to be one of the best community hospitals in America, with my college student in the back you can see, and the dog in the back of the car, we're off to Connecticut. Take care.